Okay, break. I'm sorry for that. I thank also Julene for swapping the talks also in the next session. How to assess normal venous anatomy for the systemic and the pulmonary counterparts. First of all, let's start with some anatomic details and reminders. Talking about the supradiaphragmatic district, you will have the two jugular veins, which will be linked by the innominate veins. Then you have the brachiocephalic veins, superior vena cava, and then behind it you have the azygos vein. And in detail, you see that the azygos vein is just starting at the thoracic level, goes up very close to the spine, and then it drains into the superior vena cava at this level. Second issue is the technique that you may be using to assess the veins of the fetus. First of all, you can use grayscale. These are normal cavaitral junction. You may use color Doppler with reduced PRF. Here you see a thymus and a three-vessel view in which I lowered the PRF to get the azygos arch, which is the third arch, from the azygos position here into the superior vena cava. Or you may wish to use the very sensitive new generation power Doppler. Julien has shown some. We use the HD flow together with Rabbi, and you see here also on 2D imaging how detailed you can get by using this type of sensitive bidirectional power Doppler to get, for example, all the details of pulmonary circulation. Why going to 4D? Because, of course, again, if you enclose encircle a volume rather than a single slice, you end up with seeing more of the details, and you can gather all the information that you want, both veins and the arteries at the same time, and compare the two images. This is 2D and this is 4D of the same fetus, and you can tell by yourself the difference. Or you can use, as far as 4D is concerned, the B-flow. This gives you a very nice casting of all the structure, the cardiovascular structures that you may wish to assess. And this is quite important because it's not 100%, but it's less angle dependent than power Doppler and color Doppler. So you will have very nice cast for you to assess the whole, for example, of the systemic venous return in this fetus here. Another issue to consider is that if you are going to assess the pulmonary circulation as far as the veins are concerned, you need to have bidirectional color Doppler, because in this way, since the arteries and the veins are very close one to the others in the lungs, then you may tell that these are indeed pulmonary veins because they are coming down towards the left atrium, and the same applies to these ones in red on the other side, on the left side of the heart. On the other hand, the red one is a branch of the pulmonary artery because it goes towards the lung and is not coming back from the lung. If you use unidirectional color Doppler, you will not be able to tell one from the other. So if you have to look at the pulmonary circulation, please bear in mind to use a bidirectional whatever, color Doppler, power Doppler, and not unidirectional map. Then we start to assess the different districts. Starting with systemic venous returns that you see here, you may have a longitudinal approach to this type of vessels, and in this view you see quite similar to the drawing here. The superior and inferior vena cava, here you see some of the suprahepatic veins draining into the right atrium here. The left atrium is behind here. And then you may decide to check a different level, at the upper level, if there is indeed a superior vena cava, and then you end up with the classic three-vessel view that I showed you before. Or you may check at the abdominal level, and Julien will come back to this in a few minutes, to check the situs and the relative position of the inferior vena cava and the aorta in a normal situs or in ambiguous site. So if you use this kind of approach to check for abnormalities, you may use the axial approach on the upper mediastinum, and you may detect, you see the fourth vessel here, consistent with the left superior vena cava. Or you may use the same approach, longitudinal approach, and in this case I reverse the image. Here is the superior vena cava, and there is no hint whatsoever of the inferior vena cava which is missing. You have just the suprahepatic veins draining directly into the right atrium, which is a sign confirming that this is left isomerism. Or you may wish to check at the abdominal level, and this is a normal situs, the orientation. The IVC is on the right side of the heart, the aorta is on the left side of the, not of the heart, sorry, of the abdomen, and you see here in case of isomerism again, the two vessels which lie quite one next to the other. Then you may decide to use color Doppler to enhance the visualization of your vessels, and again you can check actually at the level of the three-vessel view to check the azygos, or you may wish to use a longitudinal approach in which you use a very low PRF or the directional power Doppler, and you can make out the azygos vein which enters the superior vena cava at this level, which is a normal aspect at this level. Or also, if you go to the upper mediastinum by looking for the three-vessel view, just below the level of the subclavian arteries that Lindsay showed you beautifully in the first trimester, you may see the innominate vein here, linking the two jugular veins and the brachiocephalic veins here. If you use four-dimensional technique, probably this is the most useful one, with a single box around, longitudinal around the abdomen and the thorax of the baby. You may see the aortic arch behind, and seen from the right side of the heart, you have the superior vena cava, the inferior vena cava, the suprahepatic veins, and also the ductus venosus here. So in this way, you can actually have a very detailed assessment with one shot. You can use this, you can use HD flow with three-dimensional approach, and this will allow you with a single shot to detect abnormalities of the ductus venosus, and Rabbi will expand a bit on this later on. In this case, you was an abnormal ductus venosus draining into the coronary sinus here, and this was another case. If there is a need, a special need, or just to trace back the normal anatomy, you can also use your volumes to turn them around and to reconstruct the coronal plane of the neck vessels, and you can check that there are two carotid arteries here, and the blue ones are the jugular veins coming down towards the heart. And so the venous return from the head can be studied also with the coronal approach. Then if we move forward and we try to assess the pulmonary venous returns, again, this is a bit more tricky to assess because the pulmonary veins are located one on the top of the other, so it's quite difficult to differentiate the upper one from the lower one, especially earlier on in gestation. If you use the actual approach of the four-chamber view, like this, on two-dimensional imaging, this is the image that you should try to get, the four-chamber view, and you see the two tags consistent with the entrance of two of the four pulmonary veins into the left atrium. So this is normal appearance. It's late second trimester, but this is normal appearance of two pulmonary veins. And the task for you is just to rule out the total form of abnormal pulmonary venous return, because the partial one is, most of the cases, clinically irrelevant. You may also decide to use color Doppler to be more confident in your diagnosis of normalcy as far as the pulmonary venous returns are confirmed. Keep in mind to reduce the PRF and to expect that the two pulmonary veins should have opposite color, because one is coming from the top and the other one is coming from the bottom of the image towards the heart, which is in the middle. So you should expect reversed pattern of color here. And this is another case with another machine. Again, you see with color Doppler, the blue one and the red one, and you can rule out the total form of abdominal pulmonary venous return. Of course, if you move to 4D imaging, again, by using this type of approach, both with the axial and the posterior approach, you can make out very nicely the arteries and the veins, and you can tell what are the superior and inferior arteries, and this was with another machine as well. So in this way, it's quite simple to switch on also on 2D the HD flow, which is set with a high priority, because if you set with low priority on the grayscale signal, you won't be able to trace back the veins, but with high priority, you will be able to see very nicely all the branches of the four pulmonary veins. Again, also subtracting the grayscale signal, this was the same case I showed you before. You can make out in blue the pulmonary veins of the right side and in red the pulmonary veins on the left side. You can go into the parenchyma in this way, and you can also use your cast and reconstruct coronal images. In this way, this was an MRI angio from the posterior aspect of the heart, and you see here the 4 pulmonary veins merging at the level of the left atrium, and you can actually reconstruct the same aspect here. This is the aortic arch up there, and these are the 2 upper and the 2 lower pulmonary veins meeting at the level of the left atrium, seen from behind, and to a lower resolution, but you still can get some flow in them. You see here 1, 2, 3, and 4, and this is the back wall of the left atrium, the posterior wall of the left atrium. Sometimes, but you have to be very lucky or very patient in your search for this type of sign, you can actually spot by making it transparent on the posterior wall of the four-chamber view the entrance of the 4 pulmonary veins, but these are quite exceptional to get because I would say that I tried to make it reproducible, but it was not. Only in few cases you can get this level of detail in the assessment of the pulmonary veins. So as far as pulmonary veins, where to check for abnormalities on the four-chamber view using grayscale, and in this case you see this is the sign it should get. The back wall of the left atrium is not a continuous line. It should have 2 tags which represent the entrance of 2 of the 4 pulmonary veins. And if you have this type of smooth wall regarding of the abnormal heart, but you have this type of smooth wall, especially if you have this tiny structure here, be very suspicious because this may be a total abnormal pulmonary venous return, and this is just the vertical vein collecting all the 4 pulmonary veins. And also, if you're using color Doppler, be pretty sure that the veins are not only going near the posterior wall of the left ventricle, but are indeed entering into the left atrium, because again, in case of abnormal pulmonary venous return, you see here, you have veins from left side and from the right side meeting behind the left wall, but they just meet there and then they get either up or downwards, as Rabbi will show you after the break, in the supradiaphragmatic or infradiaphragmatic type of abnormal pulmonary venous return. They will never ever enter the left atrium in this case. And so this is the vertical vein. For example, in this case, in supradiaphragmatic, the 4 veins will meet here, and you get the vertical vein, which was the round structure I showed you before on grayscale. In some cases, it drains into the superior vena cava or into the brachiocephalic veins or whenever. And this is the corresponding, this was a similar right isomerism you see here, and with the abnormality of the abnormal venous return, or in other cases goes down, crosses the diaphragm, and you have a vessel with the meeting at the level of the portal circulation at that level. And finally, speaking about the coronary sinus, I showed you some image in my talk on moderate ventricular disproportion before. This is how it appears. It courses in the groove between the 2 ventricles and the 2 atria on the posterior wall of the heart. So on the four-chamber view, you have to go very low, almost out of the heart on the diaphragm, and you can get this image here. This is a normal coronary sinus with a lateral approach entering into the right atrium, and this is the corresponding image with an apical approach. Again, you can actually make out the tiny coronary sinus here entering into the right atrium. These are normal images. And on the four-chamber view, we will not be able to spot the cross-section of the coronary sinus. Probably it's these tiny structures down there, but you cannot make it out in most instances, only when it's hugely dilated or partially dilated by draining either the ductus venosus or the pulmonary veins of the left superior vena cava. In most of the cases, you will have this round structure in between the mitral valve and the atrium, and this will be the sign and marker for looking at the venous return in detail, because it might be for sure an abnormality at that level. So in conclusion, systemic and pulmonary venous return can be studied both by 2D and 4D echocardiography. as I told you before, use of very sensitive bidirectional power Doppler also in 2D makes this study, our lives, much simpler than before. The assessment of the sequential anatomy, and Jolene will speak about this just after the break, starting with the venous returns, of the utmost importance to detect cardiopulmonary syndromes and total abdominal pulmonary venous return. And as I think I showed you, and probably Rabbi will show some more images of abnormalities in 4D and B-flow, 4D echo probably at least reduces the time of examination and gives you the idea of a normal or an abnormal heart in very small amount of time. Thank you for your attention.